Imagine a world where doctors can fight cancer without making a single cut. No scalpels, no stitches, just invisible beams of energy targeting and destroying cancer cells. It sounds like something from a sci-fi movie, but for millions of people, it's a reality that offers hope. Radiation therapy has been saving lives for decades, but many people don't fully understand how it works. How can something as powerful as radiation, which we often think of as dangerous, actually be used to heal? For patients diagnosed with cancer, hearing the words radiation therapy can be intimidating. But for many, it's the reason they get more time with their families. The science behind it is remarkable. Radiation therapy works by using high-energy waves or particles to damage the DNA inside cancer cells. DNA is the instruction manual that tells cells how to grow and divide. When radiation disrupts this process, the cancer cells can't repair themselves. Over time, they stop multiplying and eventually die. Healthy cells nearby can also be affected, but unlike cancer cells, they have a much better ability to heal. That's why radiation treatment is carefully planned to destroy cancer while minimizing harm to the rest of the body. There are two main ways radiation is given. The most common is external beam radiation therapy, where a machine called a linear accelerator directs precise beams of radiation at the tumor from outside the body. Patients lie still while the machine moves around them, aiming at the cancer from different angles to maximize the damage to bad cells while protecting healthy ones. It's painless, much like getting an X-ray, and only takes a few minutes per session. Imagine a high-tech device rotating around a patient, delivering invisible yet powerful energy straight to the tumor. The second method is internal radiation, or brachytherapy. This involves placing a small radioactive source inside the body, directly in or near the tumor. It delivers a high dose of radiation to a specific area, limiting exposure to surrounding tissues. Sometimes the radiation source is left in permanently, allowing it to slowly release radiation over time before becoming inactive. In other cases, it's temporary, placed inside the body for a short period before being removed. A common fear people have is that radiation therapy will make them radioactive. But that's not true. External beam radiation doesn't leave any lingering radiation in the body. Patients can safely be around their family, friends, and even children immediately after treatment. Only in some cases of internal radiation do patients need to take temporary precautions. Planning radiation therapy is a complex process. Doctors first perform imaging scans like CTs or MRIs to map out the tumor's exact location. Then, using specialized software, they determine the best angles, intensity, and duration of treatment. The goal is always to strike a balance, giving enough radiation to destroy the cancer while sparing as much healthy tissue as possible. Imagine a three-dimensional model of the tumor being mapped out, with doctors designing the perfect radiation attack plan. Patients receiving radiation often don't feel anything during treatment, but over time, side effects can appear. Fatigue is common, as the body works to repair itself. Skin in the treated area may become red or irritated, similar to a sunburn. If radiation is directed at the head, mouth, or throat, it can cause temporary issues like dry mouth or difficulty swallowing. In some cases, there are longer-term side effects, but doctors carefully monitor patients to manage any complications. Radiation therapy is often used alongside other treatments. Sometimes it shrinks a tumor before surgery. Other times it destroys cancer cells that might be left behind after surgery. It's also combined with chemotherapy to create a stronger attack against cancer. In some cases, radiation is used not to cure, but to relieve pain and improve quality of life for patients with advanced cancer. One of the greatest advances in radiation therapy is precision. Newer technologies like proton therapy can deliver energy with extreme accuracy, hitting tumors while sparing healthy tissues. There's also adaptive radiation therapy, where doctors adjust treatment in real time based on how a tumor responds. These innovations mean better outcomes, fewer side effects, and more hope for patients. Did you know that nearly half of all cancer patients receive radiation therapy at some point in their treatment? Let me know in the comments if you've ever wondered how it works. Radiation has long been associated with danger. Images of nuclear disasters and harmful exposure often come to mind. But in medicine, radiation is a powerful tool, one that saves lives every day. It's proof that science can turn even the most destructive forces into something good. Science continues to refine radiation therapy, making it safer and more effective than ever before. If you found this video helpful, share it with someone who might benefit from knowing how radiation treatment works. And if you want to learn more about cutting-edge medical breakthroughs, don't forget to like and subscribe.
Got a question about how something really works? Drop it in the comments and we might cover your topic in our next video.